Ring ring. Hi, is this Dr. Sim? Hi, this is Lindsay. I'm the nurse taking care of Sarah Jason on the Sim Suite floor in room 1 at the BYUI hospital. She's the 3-year-old female that was admitted for moderate dehydration. Do you remember that patient? Okay, great. So I was just calling because Sarah's condition is starting to indicate, she's progressed from mild dehydration to moderate dehydration as manifested by her temperature of 101 degrees Fahrenheit. Her heart rate's at 110, so it's not too high, but her blood pressure is 80/62, which is kind of on the lower end of normal. She's irritable, she's having difficulty sleeping and having frequent temper tantrums. She's had 3 large, loose, watery stools in her diaper, and she's vomited twice. And then her skin is warm and dry to the touch, and she's having dry mucous membranes. So I think this is indicating that her dehydration is progressing and she's not advancing despite having the oral rehydration fluids. So my recommendation would be to continue doing the oral rehydration fluids, but maybe also do some IV fluid rehydration, maybe just with 0.9% normal saline at a rate of 50 to 100 milliliters per hour over 4 to 8 hours to rehydrate her, and also continue providing supportive care for the rotavirus by trying to manage her fever. Maybe we could start acetaminophen at like 320 milligrams every 6 hours PO for the temperature, as well as using cooling blankets and maybe tepid baths to keep that fever under control. And then with the fluids and the Tylenol, we could also, if she stops vomiting, then maybe advancing her to a brat diet to advance her diet as tolerated. Okay, and then if I got orders back, whatever the doctor would do, I'll read this order. So we're going to continue doing the oral rehydration fluids of the Pedialyte at 50 milliliters per kilogram, which is 700 milliliters over 4 hours. And then we will also start an IV and begin administering IV fluids of 0.9% NS at a rate of 100 milliliters per hour, continuous infusion to monitor for rehydration. We will also do strict I&Os and weigh diapers with every void and bowel movement, and then we will advance her to the brat diet and see how she tolerates oral food intake. Thanks, doctor.